Okay, so good evening, guys, again, and let's start. And so I welcome you all to the master's class on designing the questionnaire for the survey or the research tools and techniques and validation. So first of all, I want to know from you that whoever has worked on a questionnaire or questionnaire type of research and who is working right now on the questionnaire type of research and who are aware of the questionnaires and the surveys, please write in the text box, guys, please. So I'll come to know my audience. That's the first step we should do. Whoever has worked on the questionnaires or with questionnaires on the studies where they have used such kind of questionnaires or any kind of questionnaire, how did they design and whatever, that is separate. But whoever has worked with the questionnaires and questionnaire type of studies, surveys or anything, please let me know a little bit. Okay, Shruti has worked. Okay, I'm working on the questionnaire for taking the history of breast cancer patient. Okay, I've used the questionnaire for tuberculosis patients. Okay, so my next question is, whoever has formatted their own questionnaire, or have you used someone else's which is already validated and available in the market or available in the literature? Anyone who has formatted their own questionnaire, guys? Yes, please tell me. Okay, so I think no one, or maybe one or two. I did own. Very nice, very nice, very nice, very nice, very nice. So, okay, Mahesh Sahi and Dr. Abitone, okay, you did your own. Fantastic. So, can you please write, both of you, like, how did you find it? It was easy task or some kind of intermediate or tough? User testing questionnaire for PIL. Okay, Dr. Deepak. Okay, patient information leaflet questionnaire. Good. So how did you feel that? What kind of task it was, to design the questionnaire? And did you go to the technical parts and what? What was that? How did you find it out, guys? Tell me. Yes. ADR questionnaire, tough. Okay. Okay. Anyone else? Okay, let it be. Let's start. Let's start. So in today's class, we are going to cover the tools for the data collection, right? That is questionnaire, how to format it. Then what are the exact purpose and basics of the questionnaire. Then what are the different types of the questions in questionnaire, types of the questions, and then how to construct the questionnaire and what should be the wordings of the questionnaire, because it is very important when we are defining a question, when we are formatting a questionnaire, that should be very important for the investigator or for the author or for the researcher, whoever is making the questionnaire, because questionnaire is something which goes further and further and further to the all researchers who wants to work in the same field in the future. So we have to take care of everything, every wording, every sentence constructions, every questions, and there should be no exaggerations, there should be nothing less in the questionnaire. So we should be very much appropriate and precise when we are defining a questionnaire, when we are setting the questionnaire, right? And then the last part is validity and reliability, that I cannot do today because my software is not working at all. The SPSS is not working at all. So I'll be taking that sometimes else, but let's start with the questionnaire performer. Okay, so first of all, this is the tool for eliciting the info. Okay, eliciting info means you are taking from someone else, and representing it to the audience. Okay, taking the questionnaire or questions or the information about their own, about their attitude, about their knowledge, about their anything, about their working style, about their attributes, about their beliefs, about their opinions. So when we are defining the question, the information could be okay, isn't it working? One sec, guys, I think. Okay, yeah. So when I'm talking about the questionnaire, so what we usually, what kind of information we usually look for? First of all, we look for knowledge. Okay, first of all, we look for knowledge. Then we look for what? Attitude. Okay, how the people working, right? Knowledge is how much they know. And then how their beliefs are, how their beliefs are. Then how their opinions of the people, if you want to take opinions of the people, then behavior of the people we got to know from the questions. And then we got to know about the attributes of the people, attributes of or about the people, right? So these are the major things what we try to get in the info kind of things. So we get the info about their knowledge, how much they know about something, whatever we are fixing in the question. I'll come to that. I'll come to the entire process of setting up the questionnaire. But usually the tools or the questionnaires or the proformas, they usually eliciting the info about the knowledge, about the attitude, how they do. Knowledge means how much they know. Okay, knowledge means how much they know, and attitude means how they do, right? How much they know and how they do. Okay, so let me come up with the uh okay, I think, yeah. So let me come up with knowledge means how much they know, right? How much they know, how they do, how, okay, how they do, and how they believe. Okay, how they believe in or what they believe in, and what they think about anything which is existing or which they want to do, and how they react to something, reaction of the people, or that could be emotions, that could be some type some kind of hard reactions, soft reactions, love, emotions, anything. Okay, and attribute means about the population. This is about the population means suppose their living status, their economic status, their age, demographics, or anthropometric details. So attribute means about the population. Okay, attribute means about the population, and other things are from the population, okay, of the population, like knowledge, attitude, belief, opinions, and behaviors. But if I'm talking about attributes, attribute means about the population, exactly how, I mean, these things will be representing the population. So these things, or these are the important, or if I say, these are the important elements, okay, elements of any questionnaire or any pro forma. Okay, any pro forma, these are the major key components. Okay, these are the key components of any questionnaire, right? So you can take it from these things. And now, what exactly are the stakeholders which are involved in the questionnaire formation, validation, or approvals and everything? Wherever you see that they are involved in the questionnaire or performer setting. Okay, not only one thing. First thing is interviewer. So interviewer is not exactly the interviewer, that would be either researcher or maybe the exact interviewer, or this is like the investigator. Okay, so first thing is investigator, who is preparing the questionnaire, and second thing is who is responding. Okay, who is responding? Maybe it would be the patient, or whoever is responding to the questions. Maybe in when we are doing the questionnaire, either it is a patient, or healthy volunteer, or any vulnerable populations, like if you are asking to the pregnant woman, if you are asking someone who are working under the stress stressed environment, or who are working, or the students maybe, or the doctors maybe, or the people who suffered with some kind of attack, or maybe if you are asking in the corona patients, say they have suffered with the corona. So respondent means whoever is answering the questionnaire, whoever is answering to the questions which you have put in the questionnaires, right? So first is interviewer, then is the respondent, then once you collect the entire data, it will go to the data entry operator. So why there is a very important role of data entry operator? Because data entry operator has to enter the data perfectly. Suppose there are 5 answers, so if all the 5 answers should be entered in one column, or the separate columns are required, so data entry operator plays a very vital role. Okay, data entry operator also plays a very vital role in the questionnaire setting or the questionnaire analysis, or in getting the output from the questionnaire, right? So data entry operator is what very important element, if I say, or the important part of the questionnaire analysis, because they have to fix the things, they have to fix the data entry as per the aim and objectives of the study, right? Aims and objectives of the study. And then it goes to the statistician, and then statistician has to look for the data for data clearance, okay, data clearance and cleaning, right? And then they will do the statistical analysis to get the output, to find out the significance. So how where they look, like to look the look for the results, outputs, okay, and whatever the hypothesis says according to the aim and objective, right? So they look for that, and they does the, a statistician does the statistics or the data analysis accordingly. Then the author has to write the results, the interpretation, okay. Interpretations are very important when someone is writing the results or writing the paper or writing the thesis based on the analysis, based on the questionnaire, and based on those results whatever they get from the statistician, from the statistics. So authors are important, and authors are again one of the thing who will interpret the entire results, okay. How they have to interpret, how they have to correlate with the aims and objectives, how they have to correlate with the hypothesis, if they have to prove the hypothesis or not, right? And then the data monitoring committee will look for the mistakes, data monitoring committee will look for the mishappenings, data monitoring committee will look for the, like, if something is missing, okay. So there are multiple M's, usually 3 M's: mishappenings, mistakes, and missing things, okay. From that, if missing things, not only the data, missing things not only something which is missed from the data sheet, right? Missing things, but those will be either missed by the interviewer when they are asking the questions to the respondents, or something which is missed by the respondent, and the interviewer cannot get it, or interviewer did not get it. And then something which is missed by the data entry operator, or maybe everything is perfect but something is missed by the statistician, okay. If everything is done until the statistician, if something some wrong interpretations has been done, or some major interpretation has been left behind by the author, so data entry operators or data monitoring committee looks for those things. Is interviewer different from the author? No, sometimes interviewer or the investigator only write, but usually when we have a team for the research, Dr. BLR Madhavi, so if we have a entire team for the questionnaire, if we have an entire team for the research, then some people are working on the questionnaire, some people are working on the statistics, some people are working on the data collection, and some people are working on the manuscript writing, right? So these there are different roles, so everyone does not work in every field or every section. So there are different people, so we give them the different role names. Like someone is interviewer, who is interviewing, who is good in talking, who is good in asking questions, who is good in communicating with the respondent, right? So that person is called as interviewer here. That could be either researcher or someone from the team of the researcher, right? So it could be anyone, investigator, researcher, it could be anyone, right? So interviewer means who is talking to the respondent, who is talking to the patient, or anyone who is answering the questions, whose communication skills are literally good, right? So author means who is writing the manuscript based on the results. So these could be the one person also, these could be the different persons also from the team, right? So author. And then data monitoring committee. So data monitoring committee will be looking for triple M, mistakes, mishaps, and missing values or missing data from at any stage, not only at the interviewer's stage or respondent's stage, but at the data entry operator, or maybe statisticians, or maybe something is left behind by the author. That also is done by the data monitoring committee. And then IEC and IRB. So IEC, IRB actually takes place, so sorry. So IEC and IRB takes place before all of these. Okay, once your questionnaire is set, once your questionnaire is validated, then it will go to the IRC or IRB or IEC. IEC is institutional ethical committee or independent ethical committee. I mean, both the things are different entities, definitely, but works as the same. See, when I'm talking about institutional ethical committee, that belongs to some institution or some college or some organization or some university. Okay, that is institutional ethics committee. But if I'm talking about independent ethics committee, that means that is independent and does not have affiliation to some universities or anywhere, but they evaluate the protocols, they evaluate the studies at their own. They have their own team as per the ICMR committee rules, as per the DCGI committee rules. They have their own IEC committee. Okay, so that is called as independent ethics committee. So there are two types, one is institutional, one is independent, right? And then IRB, institutional review board, that is also similar to IEC. So the person or the investigator or the interviewer or the author, or we say usually the researcher, has to take the ethics committee approval before going to any questionnaire. So guys, it is very important, as I always say in my all the statistics lectures, all the research related lectures, that if you are involving a human being, okay, if you are involving a human being, you need the ethics approval as per the IEC guidelines, as per the ICH guidelines. Okay, that it is mandatory for everyone. That's mandatory for everyone. Okay, that's mandatory for everyone to take the IEC, take the IEC approvals if you are involving any kind of human beings, right? One sec, guys. I'm sorry, guys, I got an important call. So we need IEC or IRB approvals for that. And then there is quality control team. So quality control team usually does not take place everywhere, but it is important to have the quality control team when you are, I mean, the good universities or the, some universities have their own quality control teams. And what's the exact role of quality control team here is they usually look behind the quality of the work. Okay, IC also fix the same things, but IC usually take care of the safety of the human beings. Okay, IC takes care of the safety of the human beings, either their personal data or their anonymity, or maybe how the investigator is treating them, or how the investigator is working with them. So IC works is different. IC works in the different way, but quality control teams usually focus with the data clarity and whatever is going out from the institution, from the lab, or from wherever the work is happening, right? So quality control teams take care of the data means, or the paper or the results which are going to the public, going to the press, going to the journal, going to the government, or going to the affiliation websites, or going to the DCGI, or going to the CTRI website, right? So they take care of the quality of the data or quality of the results that should not be compromised. So these all are the major stakeholders when we are working on the questionnaire or pro forma. Okay, whenever we are working on the questionnaire or pro forma, right? So understand, guys, this is very basics about that. And now the thing is, what is basic about that? So basic is a characteristic that varies from person to person. Okay, that is the important key term of any questionnaire, guys. Why we have the questionnaire, that's important, right? Why we have the questionnaire is not like if we take 10 people or 15 people. If we have to define the big population, we need the big number. Okay, and questionnaire is still questionnaire does not define the entire population. Okay, questionnaire does not define the entire population, because one very important thing about the questionnaires or the proformas when you are taking a research is that it varies from person to person. That's why we need the maximum of the population. Still when I'm talking about the population, that does not mean you will take by yourself like 100,000, 2,000, 5,000, 10,000. Not at all. You still need the sample size. Still need the sample size, but that's why the statistical formulas for the sample size for questionnaire are different. For KP studies, usually, questionnaires are used for KP studies, okay, or to validate some kind of formulas, or to validate some kind of other things. Usually, though, maybe the scoring systems, okay. So scoring systems, okay, scoring systems or KP studies. Usually these are the two things where we use the questionnaires. Okay, so KP is nothing but, as I told in the last slide, K means knowledge, aptitude, and how they perform. Okay, how they perform, that goes to their beliefs and doings. Okay, that goes to their doings and beliefs, KAP, right? And scoring system means, suppose I want to score for the cancer, I want to score for the cancer treatment, I want to score for the cancer prognosis, I want to score the heart attack prognosis, or I want to know the socioeconomic status, or whatever. If I want to give a score to something, or I want to validate the score of some disease, or some kind of activity, or that could be anything. If I want to score something, that also can be done by the questionnaire or performance, right? So it depends on person to person and situation to situation. Like, suppose I am doing something in the Indian scenario. Okay, Indian scenario, that result will be different. If I'm doing in African patients, the results will be different. If I'm doing in Japanese patient, results will be different. Why these things will be different? Why these things will be different? Because when I am going to a questionnaire, the first thing which is very important, okay, the first thing which is very important is what I told you about attributes. Okay, attributes. Attributes are different for every population. Okay, attributes are different for every population. These are not at all same for the all populations. Attributes are not same for all the population. Attribute means their age, their height, their, age doesn't come under the things, but age is also an attribute. But majorly the race, okay, majorly the social habits, majorly the food habits, majorly the environmental factors, right? Majorly the pathophysiology, majorly the medication histories, or their medications, right? So those things are very important attributes to differentiate between the populations. That's very important. I'll come to the questionnaire, like the exact questionnaire how to set, but you should know about the basic things when we are going to the questionnaire. Usually, if you are asking me what is the questionnaire, let me define here in one set of steps. Okay, the questionnaire. Suppose you want to, so you want to ask, or you are framing the questionnaire for how the people okay, use the insulin injections. Okay, this is the question. This is the question, right? This is your hypothesis question, and this is your aim and objective in this, that you want to know the knowledge, you want to know the attitude, you want to know the performance of the people. Okay, you want to know these three things, their beliefs, their things about the insulin use. So would you like to ask or start directly with, like, guys, tell me how you are using the insulin injections? Is this the right question? If I ask someone, tell me how are you using the insulin injections? Okay, can I get the answer to my hypothesis? Can I get the answer to my question? Can I get the answer to my aim and objective of to finding out what the people think and how they are exactly using the injections? No, see, I have to frame it very importantly, very, very precisely, and we have to think about all the aspects. See, my question looks very simple: how the people use the insulin injections. But that does not mean that you go to the people, you go to someone and ask, tell me how you are using the insulin. They might be telling, I'm using like this, I'm using like this, I'm using the insulin injection. Let me come to the blank slide, constructing a questionnaire. This is the exact slide where we want to use that. So my question here is how to use, how the people are using. Okay, this is not the okay, how the people are using the this use the insulin injection. Okay, insulin injection. Okay, so that is the major part. And if I want to erase, okay, so how the people use insulin injection. Okay, that is my question. It does not mean, guys, see, that is important, where you have to focus, this is very important. It does not mean that you directly go to the people and ask, how are you using your insulin injections? They may tell you subcutaneously in the arms, okay, or maybe in the abdominal area, okay, or maybe the clavicle area, or wherever they are using, they will tell. Okay, but is this enough to justify my question? Is it enough to know about the people, right? Is it enough to define the interpretations of my question? No, because as I said, every person and every situation is different. Okay, so first of all, when I am finding a questionnaire, I'm not going to the question, how to define the question. Okay, you will get what question you have to ask to the, question means question of the research. This is the research question. This is not the question to ask the people. Okay, this is my research question. Okay, this is my research question, and under that aim is to know about the knowledge, attitude, and performance of the people about insulin injection use. Okay, that is the major aim. That is the major aim. That is the major aim of my question, my research. But to do that, what I do is, first of all, guys, focus. First of all, I have to know my population. Okay, know your population. Know your population. Right? Why I'm asking you to know your population? Because see, every person is not educated. First of all, education matters a lot about knowledge and their perception and opinions. Understand? Education of a person, or education of the patient, or education of the respondent, it helps a lot about knowing, about knowledge. Knowledge could be about the insulin injections, knowledge could be about diabetes mellitus, knowledge could be about the insulin therapy, insulin doses, side effects of the insulin, or maybe about HbA1c, maybe about FBS, PPBS, about the storage of insulin. Anything it could be. Anything it could be. So first of all, you have to know the population. Okay, that's, I just told about the education. Education can differ a lot in the situations, right? Then their residence, if they are staying in the rural areas, if they are staying in the urban areas. So how does it affect actually? See, if they are staying in the rural or remote areas, maybe the availability of the insulin, okay, maybe availability of the knowledge, maybe availability of the hospital, maybe availability of the specialist doctor, right? And those all things, those all availabilities will make the influence, or will influence the knowledge and perception and opinion of the people directly. Okay, and they will also change the attitude, because they don't get the people around, they don't get the perfect knowledge around, they don't have the entire information about all the things, about the disease, about the insulin, about the testing, diagnosis, everything, right? So first of all, you have to know your population, and knowing your population is called as attributables. Attributables. Okay, attributables, right? Attributables. What comes in the attributables? First of all, it talks about demographics of the population. Demographics of the population. So starting in your questionnaire, whenever you are starting the questionnaire, first thing you will write about the demographics. Okay, demographics, what could be the demographics? Patient's name, just like for your further information, further communication to the patient, right? Otherwise it will be always anonymous in the research, right? Then age, name, age, their residence, okay, their education. And the third thing, very important, the fourth thing is, along with the education and residence, occupation. Okay, occupation, right? So occupation is directly related to their stress level, occupation is directly related to their hard work, occupation is directly related to their physical work stress, mental work stress, about their knowledge, because if they are manager, then they might be well educated. If they are at the good position, they might be educated. If they are teacher, then definitely they are educated, right? And if they are some social worker, or they must know about the society. If they are laborer, then they might not be well educated, right? So their occupation also helps knowing your population perfectly, right? So your about their residence, about their education, about their occupation, and then their socio-economic conditions. Okay, that's very important. When you are talking about socio-economic conditions, that is not only the socio-economic one thing, but there are the parameters of socio-economic conditions, like if they are poor, if they are middle income, if they are rich, if they are having the there are the categories of socio-economic status, right? So socio-economic status does not come only with the salaries, but along with that salary, okay, their occupation, their education, entire things, everything comes and make a scoring of socioeconomic status. And that also helps, because socioeconomic status helps in the affordability of the medicine, affordability of the services. Not only the medicine, if I'm talking about the insulin, then it is medicine. If I'm talking about some services, then services of like doctor or going to the hospital. Poor people cannot go to the hospital every day, right? They cannot visit the specialist every day because their fees is 2000, 5000, 200, at least 500, right? So socioeconomic status directly is relating with the affordability of the services, affordability of the the medicine, affordability of the drugs, affordability of the visiting doctor or anything, right? Whatever is comes with the money, that comes with the affordability. Okay, maybe the travel, maybe their daily cost, maybe their food outside. So everything includes in the socioeconomic status and affordability. So these all things comes under the demographic characters. These are very important when you are knowing your population, right? And then the second thing in attributables, only second thing in attributable comes is anthropometric details. Okay, anthropometric details also helps in knowing your population. Like what is their BMI, right? What is their BMI, their height and weight, right? And what is so these are important thing. What is their waist ratio or hip ratio, hip waist ratio, right? HW ratio. Okay, so these things are important of knowing the people, like if they are obese, if they are lean, how they behave with the food, how they're reacting to the food. So multiple things, how they will react to the prognosis of the diabetes mellitus, if I'm talking about anthropometric, right? So one thing is demographics, then second thing is anthropometric, then the third thing in attributables is their social habits. Okay, social habits means if they are a smoker or not, if they drink or not, like if they are alcoholic or not, if they chew tobacco or not, right? Tobacco chewer, right? Or if they have any other drug abuse or not, right? What is their sleeping habits, what is their sleeping habits, sleeping habits sorry sleeping habits, right? So these all things come these all things come with the social habits, when we are talking about the social habits of the populations. So the entire thing when I'm talking about is knowing your population, right? And in this only, if we are talking about the patients, this is like when we are just talking about a healthy person or healthy volunteer or some vulnerable population, right? Now if I'm talking about the patients, then few more things add here. Fourth is, if I'm talking about medication and medical history, right? What they are eating, what kind of disease they already have, which can influence the current problem, which can influence the current treatment, which can influence the current prognosis. So these things are very important to keep in the questionnaire. Then very important, surgical histories in the childhood, or the recent surgical histories, or contraindications, right? Contraindications or allergies, whatever is there, these things are important. Definitely these things will make your questionnaire longer. These things will make your questionnaire longer, and it will not literally sometimes it's boring to answer a lot of questions. But when you are constructing a questionnaire, these all parameters are relevant. These all parameters are relevant, and relevant on the situation to situation again, situation to situation again, right? So that is the first part of that. I think that is the first part of the questionnaire, right? So first thing when I'm constructing a questionnaire is, what is the here, if you see, wait, let me select. Okay, so this is the first thing. What is the information needed? What information is needed? Okay, so this is the basic information which is needed. Okay, and how the info would be used. I told you how the demographics will be used, how the anthropometric details will be used, how the BMI, social habits, how the surgeries and attributables are used, how the allergic will be used, allergies will be used. Okay, and then if the information is already available or not, that is important to understand. That is important to know. Why? Because sometimes you are dealing with the, see, questionnaires are not importantly like you are just directly interviewing the patient. Sometimes you have to collect the information from the retrospective data also. Okay, that's not directly that you sometimes you all the time you are asking the questions, going to the people and asking the questions, but sometimes you have to frame the questions, and you are getting the information from the recorded data. You are getting the information from recorded medical proformas or medical files, or the medical records of the patient. So if the information is already available or not, that is very important to understand. So you have to list out when or what you are doing. Okay, and then again, in constructing a questionnaire, what's important is, ask the questions which are essential. Okay, ask the questions which are essential. Suppose suppose I'm talking about the questionnaire on, as my question was, how people use the insulin injection, right? So if I ask you if you are married or not, right? If you are married or not, how many children do you have? It may be relevant in finding the affordability or their expenses in different things, but these questions are not directly essential to my question, okay, or my aim of the study, or my objective of the study. These questions are not directly correlating. Okay, if the person is married or not, right? If the person is having children or not, how many children are there or not, these questions are not at all relevant. Okay, so relevancy is very important when you are asking a question, when you are constructing a question. Essential questions are only needed in the questionnaire or the performa. Irrelevant questions are not at all needed. Okay, irrelevant questions are not at all needed, right? View questions from the respondent's angle. You should not ask the offensive questions. Okay, you should not ask the offensive questions to anyone. Like suppose you are talking about, you are preparing the questionnaire, you are preparing the proforma about psychological conditions, right? So you should not ask something which is offensive, right? Which is offensive. Sometimes we prepare the questionnaire for sexual diseases, right? Sometimes we prepare the questions for maybe the infectious diseases. So we should not ask the questions which are offensive in the nature, which are offensive in the nature. If there is something, you should ask the permission, you should ask the respondent, like, okay, there will be some questions related to that, but again, you have to frame the question in such a way that it is not offensive. Okay, so you have to prepare the questions as per the respondent's angle only. Okay, you cannot think as the investigator. If you are thinking something is very important, suppose I'm asking about infectious disease. Okay, I'm talking about some sexually transmitted disease, STDs, right? So I have to prepare the questions very carefully, like what to ask, how to ask, like how many partners did you have, right? If I ask someone how many partners did you have, or how many times did you have sex in last 1 week or last 1 year or whatever, last 1 month, that question can offend the person, can offend the respondent. Okay, so such question cannot be asked directly. We have to ask in a different way, in a different angle, which cannot hurt the respondent. Okay, which cannot offend the respondent. So we have to think as the respondent, not as the investigator all the times. And when we are preparing the sensitive questionnaires like for the STDs, for the infectious disease, or there are certain areas, there are certain fields, when we are preparing the questionnaires for such fields, we should be very, very careful. We should be very, very what we say, we should think about the respondent's angle, not about the investigator's angle. Maybe the direct question is very important, and direct question can give the perfect answer, right? As an investigator, you might be thinking that direct question may give you the perfect answer, but maybe that can hurt, that can be offensive to the respondent. So such questions should not be asked, right? And again, as someone is writing here, how can we ask a female patient regarding use of oral contraceptives? Become some may not say, right? Exactly. So that kind of questions which are not which might be offensive, or which might be the patient or someone respondent might may feel shy, okay, answering those questions, or may not answer those questions in front of their parents, in front of their friends, in front of someone else, or they may not be comfortable answering those questions to you directly, to the investigator also, because or they are those questions are related to their very personal life. Okay, so either remove those questions or alter those questions. Okay, so my perspective here is, when you are framing a questionnaire, I mean, for such sensitive areas, then you have to think of the respondent's angle, not the investigator angle. Okay, and such areas are STDs, or infectious disease, or the psychological disease, okay, or psychological performance, or knowledge about sex knowledge, okay, when we are working on these areas. So these are major areas which can offend. Even some people can offend in the simple things also. Okay, some people can be offensive in such important areas also, but that's, you cannot do anything. But still you have to think of the respondent's angle. Okay, and be selective and realistic. Don't ask them the hypothetical question. Okay, don't ask them the hypothetical question. And the question should be realistic. You don't ask what will happen to you after 2 years. Okay, can you answer what will happen to you after 2 years? How or do you think you will die after 1 year? Is this question to be asked? Not at all. Okay, such questions which are not realistic, which are hypothetical, should not be asked to the person or the respondent at all. Okay, you should not ask them if you will take the medicine in the future. That question does not belong. That is hypothetical. You will get the wrong answer always, because no one knows. Okay, so hypothetical questions should not be asked. Hypothetical questions should not be asked. Now, I was talking about the things. So first thing is attributables. Okay, I talked to you about the attributables, but along with the attributable, we have something of something kind of information which is okay. So let me finish this first. So what kind of information? I already told you. First is what people know. This is knowledge. Okay, what people think and do is attitude. Okay, attitude. What people do is perception or performance. We call it perception or performance. Okay, and what people are having or have is attributables. Okay, so we have talked about attributables and all already. So these are the four things we must have the knowledge about in our questionnaires. But so what is knowledge? What is knowledge? Now attributables I have described to you. Okay, second thing is knowledge. So the knowledge is what people know or understand. Okay, know or understand. Let's go back to my question. Insulin, injection use, Okay, insulin injection use. Now I know my population in insulin injection use, like about their socioeconomic habits, about their affordability, about their social, habits, about their, things. Now my next section of questionnaire will be, let's check the knowledge of the patient. So I'll check how much they know about diabetes mellitus, how much they know about HbA1c, what is the, cutoff HbA1c, right? Cutoff HbA1c, right? When they are called as diabetes, okay? And what are the basic treatments of diabetes? And my specific question is insulin. So how much they know about the insulin, okay? If they think insulin is beneficial or not, if they think insulin is, they have to take the insulin permanently, or it is a temporarily use. Sometimes some people think that insulin is a permanent thing, they have to take the insulin for permanent, right? So what they think, what is their perception, how much they know about the disease, how much they know about the treatment, how much they know about, if I now come to the insulin injection perfectly, where to take the insulin injection, right? What are the sites of insulin injection, where would you save the insulin or store the insulin, right? In the fridge, in the normal temperature, in the cold temperature, or wherever, right? So these things comes under the knowledge of the subject. Okay, knowledge of the subject. So when I'm talking about diabetes, the subject would be disease, subject would be treatment, subject would be prevention, management, storage, injection, right? So those are all the subjects when I'm talking about the knowledge of the subject to the people or to the respondent, right? So questions here questions could be multiple types. Okay, first is offer choice between correct and incorrect. If you know or no, I mean, if you know about the disease, yes and no. Okay, so that is the correct or incorrect questions, right? Or if this information, the HbA1c cutoff is 6.5, yes or no, it is correct or not, it is correct or incorrect, right? So we can ask the questions in multiple ways, right? Offer the choices how they want to answer, how they want to answer, right? As per the respondent, we have to give the choice, we have to give the choice, like either in yes or no, okay, correct or incorrect, okay? Or maybe, if I say there are two types of questions, open ended or close ended, right? Open ended and close ended. So what are close ended questions, what are close ended questions, and what are open ended questions, guys? Can someone tell me what are open ended questions and what are close ended questions? Close ended and open ended questions. Yes, guys, tell me what are the close ended questions and what are the open ended questions? Tell me. Yes, please tell me. Anyone? Open ended questions. Okay, open means the subjective answer. Okay, so what is exactly the open-ended question? What is exactly the close-ended question? Close-ended questions means you are giving the options by yourself, and the patient or the participant or the respondent has to select the answer from that. Okay, respondent has to select the answer from that. Suppose first thing is yes or no. You are just asking whether the answer is yes or no. So respondent does not have any other choice. That is the close question, close-ended question. If I'm asking if the thing is correct or incorrect, if the statement is correct or incorrect, that is also close-ended question, because I'm not giving the person any choice. Okay, I'm not giving the respondent any different choices, right? They have to select from that. If I'm telling what is the pain score, okay, pain score from 1 to 10, this is also the close-ended question. Okay, they have to select between 1 to 10 only, right? If I'm asking how they are feeling today, 1 to 5, that is also the close-ended question. Okay, that is also the close-ended question. So you have to offer them the variety of questions based on the respondent and based on the aim, objective, and hypothesis of your research. Understand? Based on the hypothesis, aim and objective, and the respondent. You have to keep these four things in the mind when you are framing the question. When you are framing the question, first is respondent, hypothesis, aim, and objective of the research. Okay, of the research. That will help you framing the correct question. That will help you offering the correct options to the person. Okay, so and then study the awareness. So that will help us in the in studying the awareness of the person or studying the knowledge of the people, right? So usually when we are talking about the knowledge, we have to give them, or we have to offer them very specific close-ended questions. Okay, sometimes, see why I'm talking about the close-ended question here. See, open-ended questionnaires, as you might be knowing, but let me tell you again before believing and all. Let me describe here. There are two types of research. Okay, there are two types of research. One is quantitative. Quantitative means where we have to do the analysis with statistics, and we need all the answers in numeric form. Okay, numeric form, right? So when I'm talking about numeric and quantitative questionnaires, I want the answers either in the numerics or nominal type of answers, right? 1, 2, 3, 4, 5, whatever the score. If I'm talking about yes and no, 0 and 1, or 1 or 2, whatever you want. Correct or incorrect, 1 or 2. Veg, non-veg, or mixed, 1, 2, 3. Married, yes or no, right? 1, 2. So those things, when I want quantitative analysis. Quantitative analysis means we have to give the numbers. We have the countings. We have the what we say, the countables or measurable attitudes or measurable attributables, okay, or measurable elements or measurable variables, right? So in such cases, we have to usually, in that cases, we have to give the closed ended questions. Remember that when I'm doing any kind of quantitative analysis or quantitative research, usually all the research what researchers do in the patients and all usually are quantitative. Okay, so in such cases we should give usually not all, but sometimes we have to give the open-ended questions also, but usually give the close-ended questions or the options, right? But when I'm asking about the open-ended questions means the respondent. Open-ended questions means what? Open-ended questions means what? Open-ended questions means what? In that, respondent, okay, respondent has the liberty to answer according to them. Okay, they have liberty to answer. They have the liberty to fix the answer and tell the answer in whatever words, whatever terms, or they are here free to give the statements. Open-ended questions means we give them the choice. Okay, we give them the choice, right? We give them the choice. So what are the open-ended questions usually? Open-ended questions, simply I'm telling you, if I'm asking about comorbidities. Okay, comorbidities are usually, if you say, okay, I can write here cardiovascular comorbidities, neuro problems, okay, infections, or maybe diabetes, non-cardiac, cardiac, okay, diabetes or hypertension, okay, and there are endless things. So you have to put the other also. You cannot restrict. If you are asking about comorbidities, I mean, that is up to that is up to you. You have the choice to end the comorbidities in 2 options, 3 options, 5 options, 10 options. But if literally you want to know about everything, then you have to keep one section at the end, that is others. So others means you are giving a choice to the respondent. Okay, and sometimes you are giving the choice to the respondent in asking whatever, like, what do you think about the current scenario of education? What do you think? Write 5 statements about anything, whatever the question is. Okay, what do you think how we should use the insulin? If I'm doing the qualitative research, not the quantitative research. If I'm doing the qualitative research, then I'll ask the patient, what do you think about the insulin? Is it safe or not? Then patient has the liberty to give the statement, whatever they think, whatever they believe. Okay, so that kind of questions are open-ended questions. That kind of questions are open-ended questions. And in such cases, what we do is, in such cases, statistics is quite different. In such cases, we don't do the usual statistics. In those questions, in those from those statements, from everyone's statements, we get some common keywords, and then we analyze those keywords. So qualitative research, I'll not go, because qualitative research is something different than the quantitative. But usually when I'm talking about in quantitative research, we go for close-ended questions. And if there are such open-ended questions also, if there are some open-ended questions also, like comorbidities, okay, or maybe something else where you have the others. So what you will do is you will code that. Okay, I mean, in quantitative analysis, you have to code everything. Okay, like suppose when I'm talking about contributions, contributory factors or comorbidities, like cardiovascular problems 1, okay, neurological problems 2, infections 3, diabetes 4, hypertension 5. These are the 5 major comorbidities, and all others will come under the 6. Whatever the patient says, patient has the liberty, but we will code under the 6. We will code under the 6. And if there are some major contributors, then we will write in our discussion, okay, along with these 5, our population has the major cancers also, right? So those will be written as the text, but in the codings, the 6 will be representing all except these 5, all except these 5s. Understand? So that is about the questions, open-ended questions, or not open-ended questions, or close-ended we call them, right? So that is about the questions. Now, okay, I'll get the questions. Some questions are there. What food do you eat for breakfast? This is open or ended? This is open. Okay, this is open. But if I ask this in the different way, like what is your food habits, veg, non-veg, or mixed, that is close-ended. Okay, that is close-ended. What did you have in the breakfast? That is open-ended, right? So they can have, they have the liberty to tell, okay, I have cereals, I have bread, tea, or omelette, whatever. That means they have the liberty. So in such cases, that goes to the qualitative analysis. So we get the answers of 100, 200, 500 people, and we find out some common things out of all 500, out of all majority of the population, and then we will make the course of that and we'll analyze those things. That is qualitative research, but I'll not go to the qualitative research. Okay, details and qualitative response, giving thoughts, feelings, experience. Yes, absolutely. Want the data be too diverse to arrive at any conclusion if open-ended questions are given? Absolutely, absolutely. That is, see, when we are arriving to a vast conclusion or the diverse conclusion, that is called as qualitative analysis. That is called as qualitative study, because we are asking about the perceptions, we are asking about the different diverse what we say their thinkings, their beliefs. We are asking for the diverse thinkings and beliefs of the people, right? So no, Sandeep, this is the wrong question at wrong time, because that analysis is under the qualitative data analysis, and that is totally different. That will take some other master class on qualitative analysis. That is not feasible here to tell. Okay, so qualitative analysis are different, quantitative analysis are different. Okay, so we are talking about quantitative analysis, right? So when I'm talking about belief, attitude, and opinions, I already told you, but we talk about psychological behaviors, we talk about perceptions. Okay, like what do you think will be the biggest challenge for students in the university, right? So that kind of things are perceptions of the people, and that goes with the you can give the close-ended question also. You can give the like challenging, not challenging, intermediate, challenging, and they can easily bear it. So you can make the close-ended questions also, you can make the open-ended questions also here, right? Now if I talk about behavior, what people have done in the past, they are doing now in the present, and will be doing in the future. That kind of behaviors usually come under the when I'm talking about qualitative analysis. Okay, and behavior also is like that is usually qualitative analysis. But when I'm talking about quantitative analysis, like the question I kept here is, do you keep insulin in the fridge? Okay, so if they say yes or no, if they say yes or no, what is their behavior about the insulin? Okay, what is their behavior about the insulin, how they are doing. Okay, this is not knowledge. I'm not asking about the knowledge. If you know that insulin should be kept in the cold place, not in the freezer, okay, that would be the knowledge. I'm asking, do you keep insulin in fridge? So this is, I'm asking about their performance. I'm asking about their, how they behave, how they are doing. Okay, how they are doing. So that's how, there are three distinct sections when I'm talking about KAP: knowledge, aptitude, attitude, aptitude, and P, performance or perception. That is the different three sections when I'm talking about. So behavior means how they are doing right now. Okay, how they do, if they are taking the injections in arm or are surrounding the or around the stomach. Okay, that means the sites of the injection, right? So that shows how they are behaving to the treatment. Okay, how they are storing the insulin injections, right? Or if I ask them, do you check the insulin units before taking or not? That means I'm asking about their behavior. I'm asking how they are doing it. Suppose not only insulin, maybe some people are from not from the medical side. Suppose they are from the, they are general public, right? Suppose they are general public, and you are asking them, did you take dolo during corona? Did you take dolo during corona? That I'm not asking about their knowledge. I'm asking about their behavior, about their perception, not perception, sorry, about their behavior, about their doing, about their performance, what and how they are doing, right? If I ask them, okay, did you go to the quarantine when the corona was there? So I'm not asking them if they know about the quarantine or not. I'm asking if they did it or not, right? So that is about their behavior, about their doing, how they are doing it, right? So that is very important to define the questions in different sections. First is attributable, then the knowledge, then the behavior, then the attitude. We call them KAP studies. Okay, KAP studies. Usually, as I told you, either we prepare the questions for KAP studies or for the scorings. So scorings are normal one. Like I'm asking the questions. Scoring means, suppose I'm talking about the Mars medication adherence questionnaire. Okay, medication adherence questionnaire, medication adherence, or scoring. Okay, medication adherence rating, scoring, whatever. I'm talking about the medication adherence scoring. So how many days did they take medication? How many tablets were empty in the box? Okay, then how they remember, how many times they remember to take the medications, how many times in a week they travel, how many times they miss the tablets. So different questions are according to the definitely our aim and objective, but in the scoring system, right? And at the end, for every question we will have the scores 1 to 5 or 1 to 3, whatever is there. I mean, different scoring systems have different scores, and then at the end we get the final score, and we divide into like if they know poor, high, or strong, or whatever is there. Okay, knowledge about their scoring systems, if they are medication adherent or non-adherent, intermediately adherent. So there are the scoring system, those are quite easy. But when I'm talking about KAP studies, you have to define very carefully, like what is knowledge, what is aptitude, what is their perception or performance. Okay, that is very important to understand. Okay, so then attributes, I told you demographics and anthropometrics, I told you many things. But let's go back, because I think we have come to just to understand the questionnaire, we have gone so far. Let's go back. Okay, so there are multiple important things. So this is questionnaire performer, this is questionnaire basics. Okay, and this is the important thing, what you should understand. How do we select the questionnaire? I mean, I have described, but this is the normal phenomena, this is the normal performance chart, this is a normal questionnaire designing chart. So there are three stages. First is preliminary considerations, then development process, and then the validation process. Okay, if we take the technical process of questionnaire development, there are three things. One is preliminary considerations, then the development or translational process, and then the validation. Okay, so what is preliminary considerations? Identify or construct the interest. Construct the interest means constructing your question, research question. What is your interest? Where you want to work? In which area you want to work? So area of research, area of research, and then you will define the aims and objective. Then you will define the hypothesis, right? That's how you come up with the question. Now there are two things. If you have defined to go for questionnaire related research, okay, if your hypothesis, remember what I'm saying now, if your hypothesis or aim and objective or research question warrant a questionnaire, okay, warrant a questionnaire. If it is required to have a questionnaire in your research, suppose I'm going to check the health related quality of life, I warrant the questionnaire, I need the questionnaire, right? So there are multiple SF36, there is European Society, European Quality of Life questionnaire, IQ5D5L, okay, so 5L questionnaire, there are multiple, okay, there are Kansas questionnaire, okay, so there are multiple health related quality of questionnaires. Mars, if I'm talking about, what we say, if I'm talking about medication resilience, I'll go to the Mars, or I'll go to the Morisky, okay, Morisky. So there are multiple different questionnaires for different aims and objectives. My perspective here is, if your aim or if your objective, if your hypothesis, if your research warrant a questionnaire or not. If it is yes, then the next step is the questionnaire, is the validated questionnaire available or not? If the validated questionnaire available or not. If it is available, then if it is available in the required language, then no need to go anywhere. Check that. If it is feasible to your population, go and take that questionnaire and apply. Okay, and if it is not available in your language, then translate the questionnaire. Then translate the questionnaire, right? Now, the main thing here is, if you don't have the questionnaire validated for your or related to your aim and objective, related to your hypothesis or related to your research question, what will you do is, you will develop the questionnaire. You will develop the questionnaire, and development of the questionnaire, as I told you. But still there are certain things what are specific there, like establish the expert committee. Expert committee means, like, suppose I am writing the questionnaire, okay, I and my team, entire team of experts, they made the questions. They made the questions for suppose K, A, P and attributables along with, okay, my team prepared the entire questionnaire, but still I need the expert committee to validate it. My team needs one expert committee, external expert committee, to check those questionnaires on certain parameters, like if those questions are relevant to the subject, if those questions are relevant to my aim and objectives, if those questions are relevant to the hypothesis of my question, a hypothesis of my research. Okay, so the expert committee will look into the questions, and they will rate the questions, they will validate the questions. Validation means they will externally validate the questionnaire. Okay, internal validation means I'll check the Kappa score, I'll check the Cronbach alpha score, okay, in the statistics with the help of statistician or with the help of softwares. That is the internal validation. External validation means I'll send my questionnaire to the experts, they will check the relevancy, they will check the, as I told you, if there is something less, or if there is something missed, or if there are some extra questions which should not be there, which are not relevant, those questions can be removed, or based on their ranks, based on their points out of 5, how much it is important, 0 to 5, right? So every question they will read, they will check with the hypothesis, and they will rank, they will rate the question, or if there is any kind of corrections needed, right? So usually when we prepare the questionnaire, we send it to the expert committee. Expert committee means not a specific committee, but there are 5 to 7 people or 5 to 10 people outside. Suppose I'm preparing a questionnaire on diabetes, knowledge of diabetes, right? KP of diabetes or insulin injections, right? If I'm asking about insulin injections to the people, what I'll do is I'll prepare the entire questionnaire according to my knowledge, according to KP, according to whatever I have to follow, attributables, KP, all everything, and then I'll send it to some physicians, some nurses, because nurses are key holders, okay, and then I'll send it to some cardiologist, or I'll send it to some experts of this field, right? Endocrinologist, right? I'll send it to some gastroenterologist, I'll send it to some skin people, because they know how the injections are reacting, how the there are multiple complications of the injections. So I will take the opinions, where I'll take the opinions of everyone, I'll take the ratings of everyone, and then I'll go for the internal validation. Okay, that is the correct process. That is the correct process of questionnaire. It is not like, okay, you are sitting in the house, you prepare 10 questions and just open the Google form to everyone and they will answer. Not at all. This is not the right way for the questionnaire validation. This is not the right way to ask this, to do the survey. Okay, this is not at all the right way. Someone's video is open, or open. Sandeep, your video is open, please off the video. Okay, so this is not the right way. You have to do properly, you have to take the proper validation, you have to follow the proper process when you are doing the, when you are preparing the questionnaire. Okay, so as this is there, determine the item formats, item development, and then and very important process here is, once you develop the entire questionnaire, you have to go for preliminary pilot testing. Why this preliminary pilot testing is important in the questionnaire? Why this pilot study is important even after the validation, why, or before the validation, why this pilot study or pilot testing is important? Why? Because questionnaires are time flexible. Okay, time flexible means they sometimes take 10 minutes, sometimes they take 30 minutes, sometimes they take 2 minutes. Different questionnaires have different timelines. You cannot restrict the questions, or you cannot restrict the timelines, okay, with every individual. If there are 5 pages of the questionnaire, definitely it will take 30 minutes, right? So if the questionnaire is taking 30 minutes, if the questionnaire is taking 30 minutes, what you have to follow? First of all, interest. Did you hear of interest? It should be interesting, it should be relevant, it should be in the sequence. Remember this. If the, first of all, questionnaire should not be for the longer time, it should not consume more time, otherwise the respondent will feel bored and they can leave. There are the high chances of no retention. The people will not retain till the end. If you are sending to them, if you are going and interviewing them by yourself, then it's okay, you can bound, you can talk to them, you can communicate with them, you can bind with them, okay, you can vibe with them to ask the questions. But if you are just sending the Google form and asking, yeah, please fill the form, please fill the form for my questionnaire, that's the problem. The major problem is time. Okay, because it takes a lot of time, it takes a lot of time. So if it is time taking, time consuming questionnaire, then you have to make sure that it is interesting, all the questions are relevant, okay, and each and every question is in the sequence. So these are connecting the dots, like this is making interesting. Okay, I'm asking, how many hours you are spending on Netflix per day? Okay, that's the first question. Then, oh, what you are watching then, okay, what is your genre to watch? If you are watching comedy, if you're watching horror, if you're watching romance, or if you're watching some thriller or what. Then in thriller, which is your favorite movie, or which is your in thriller also, if you're watching web series, or long serials, if you're watching the movies, short movies, or whatever. Okay, so that kind of things, what kind of thriller you like, so every dot should be connected. Okay, every dot should be connected, it should make it interesting, and it should be in a perfect sequence, it should be interesting. That's why you will make the perfect retention with the audience. Okay, and to do that, to check the interest, relevancy, and sequence, you have to do a pilot study in very less sample size, like maybe with your friends, with your colleagues, with your teammates, some 20, 30, 50 people. You have to make the pilot, you have to do the pilot, and then once it is perfect, once you check the feasibility and interest and relevance, then you can go for the full-fledged questionnaire, full-fledged survey, or the research. Okay, reliability and validity we will check in the next class. Okay, so we almost covered everything, but the major things are there, some more important things are there, like okay, so attributables we have covered. Wording of the questions. So first of all, know the target population, purpose of the questionnaire, important. right? Types of the question, open-ended, close-ended, discussed. Make the response categories clear. That is important. That is important. So if there are some response categories, scorings, okay, if you want to score or if you want the responses, suppose there are three things. One is poor, first thing, poor spacing, two is poor logic, third is better. So better means the correct shape. Poor spacing is what? Suppose I have to divide my population. I have to divide my population according to age, right? I have to divide my population according to age. So I am writing 1 to 20 years, 21 to 45 years, then 45 to 60 years, then 60 to 70 years, then 71 to 90 years. This is poor spacing. This is called poor spacing. There is no proper gap between the categories. There is no proper gap between the categories. This is called poor spacing. Okay, this is called poor spacing, right? This is called poor spacing. You should not do that at all, right? It will make confusion. This will not give the correct results. This will not give the perfect results and perfect spacing to the results or statistics when you are checking, and it will not help in the correct interpretations also. Poor logic means 18 to 40 years, 18 to 40 years, 40 to 45, 45 to 50. What is this logic? No logic. Why you are taking 18 to 40 first and then 40 to 45? This is not a proper logic. Okay, you should have the proper logic behind when you are categorizing the responses. Now better is what? You can keep more than 20, then 20 to 25, then 26, 20, less than 20, suppose, or less than 18, or 18 to 36, right? 37 to 54, then 55 to 72, like that. Or if you are keeping only adults, then you can keep 18 to 25, 25 to 30, 30 to 35, 35, 36 to 40. So the sequence or the spacing should be correct. Okay, that should be better, so it will help you interpret the data correctly. Okay, so make the response categories clear, not the poor spacing, not the poor logic. It should be in the better shape. Understand? So many people I have seen, they just keep according to their knowledge. Okay, poor spacing is very common. Poor spacing and poor logics are very common when you are when you are keeping the questions, when you are keeping the responses, right? So formatting the questionnaires, appearance should be good. I mean, the questions should look good. Questions should be correctly formatted. No offense. Length of the question should not be too much. It should be direct question. Okay, and order of the questions should be perfect. They should be in the relevance. They should be in the sequence. They should be correcting the dots. So maintaining the flow, pilot study, I told, response format. So if I'm talking about the response format, you should be very careful when you are, what type of data are there. One is like, if I'm asking about the gender, then it would be, string data. Okay, string type of data. When I'm asking about the age, that is continuous type of data. If I'm asking about, if I'm talking about the rating, that will be nominal type of data. Okay, that will be nominal type of data. If I'm asking exam scores, that will be rank type of data. So data, data response format should be very clear, right? So, if you are asking the gender, it should not be in the numerical form or categorical form. Okay, it should be in the proper string form. Okay, yes or no, male or female. Okay, it should not be categorized one or two, because it should not be ranked, because male and female cannot be ranked, right? So gender is the string data, and it is like nominal type of data. Rating is discrete data. Okay, exam score could be like ranked, or age could be your continuous data, right? That can be very, very responsible. You should be very careful and responsible when you are formatting the questions, because answer will be reflecting like that. Answer will be analyzed according to the question and format of the question. Okay, then thing is, visual analogs are very important to show. Suppose I'm asking, I'm asking the people, rate your health in 1 to 10, or rate your pain in 1 to 10, pain in 1 to 10. So it is not right. It is not, you can write 1 to 10 also. They can answer in 1 to 10 also. But if you are asking about pain, then you can give the smileys. You can give some visual analogs. 1 to 10, a red, then a happy face at the end. So sometimes visual analogs are good, and it makes interesting. It makes the questionnaire interesting. Okay, these things make the questionnaire interesting. Visual analogs, figures, or emojis. Those things make the questionnaires correct. So these terminologies are related to the validity that will take in the take in the next class. And let me just show you. I have 2 minutes. Okay, so I have the examples also. I got the examples also for you about the from the questionnaires, like what are the assessment of knowledge in insulin, what are the assessment of attitude, what are the assessment of practice or performance. So those things are there. So these things I'll take in the next session, guys, no problem. Okay, and don't worry about the certificate. So I had the questionnaire also. There are 64 questions in the questionnaire. That also can be discussed in the next time. And I got all the material for you, like what are the kappa scores, what are the Cronbach alpha scores to the degree of reliability and validity. I if my SPSS is working, I would have do that. Okay, so these are the things what I had to take, but I cannot take right now because of the software. Okay, guys, so that's all for today, and I'll take the session soon, and I'll be informing you all in the email. Okay, my team will be informing you and telling you about the next class whenever is the next class. Okay, and your certificate will be given that time, or if you want, you can. Yeah, questions on Likert score also. Likert score also, I'll tell when I'm talking about these things. Likert score is nothing but the scoring system, or the rating. Okay, rating is the Likert score. Or when we talk about the classes, okay, 1 2 3 4, or hypertension class 1 2 3 4, there's a Likert score, pain score, Likert score. Okay, so Likert score is nothing but when we are ranking, or when we have the numbers in the categories. Okay, different categories. So that is Likert score. I'll talk about the Likert score in the next class. Okay, in the next session, guys. Okay, so this is all about today. So if you have any questions, you can ask me now. And there are biases also, multiple biases in the questionnaire. That also I'll take next time. How to eliminate the insignificant questions with the validation. That's why we do the validation. Okay, external validation is important. How to remove the insignificant questions or irrelevant questions is by the help of external validation. Okay, that is the important part. Okay.
Sir, in the validation part, you're using the SPSS software, right? So,
Yes.
is there any other software for the same thing, for validation
Yes,
purpose?
we can do by Prisma also. We can do by R also. EZR, R software is there. What I have used for validation till now R and SPSS, and there is SAS also. SAS is also can be used for validation, but I'm not I'm not familiar with SAS. I'm familiar with R, EZR, which is freely available for everyone, and SPSS.
Okay, sir. Thank you, sir.
Which test can be used to analyze such questionnaires? T-test or chi-square? No, there are specific tests to check the score, and those scores will be put in the SPSS, and we will check the kappa scores and Cronbach alpha scores, like the sensitivity and specificity of the questionnaire. We check the sensitivity and specificity, and that is coming by the help of Cronbach alpha and kappa scores. Okay.
How to do the phase validity and the content validity of the questionnaire? Phase, content, construct validities of the questionnaire.
Oh, that I'll read. That I'm sure about. Face validation, I'm not sure. Face validity and all, I'm not sure. Literally, I'll check that.
Okay.
Yeah, I'll tell in the next. That's great question. So I'll take it, and I'll write for the next class. I'll check it in the next class, and definitely would answer. That's right that you have told me today. Anyone else? Any other questions, guys? If any questions which I don't know, I'll definitely come up in the next class or whatever. Okay, if not, then I'll my team will convey the message about the next class. Maybe definitely for by next week I'll take, because I'll be back, and my software, I think SPSS will be corrected by tomorrow only, but tomorrow afternoon only I'm flying, so I cannot take tomorrow. I'll be taking next week only. That's the time. I'm into the pharmaceutics and we'll talk value addition. Okay, thank you, Dr. Madhavi. Thank you. Okay, guys, so take care and I'll see you in the next class. Okay, thank you. Thank you very much, guys. Thank you. And there are a lot of things to talk in the next class. Don't worry. There are a lot of things to talk. I think this, I thought of, 2 hours or 2.5 hours, but, I'll take another 2 hours to talk to you about this questionnaire and validation things. Okay. Thank you. Thank you guys. Take care. Good night.